Counselors have a professional responsibility to approach the selection, administration, and assessment tools with great care and mindfulness. It's essential that counselors clearly explain the purpose of the assessment and how the results will be used, as well as to obtain informed consent before sharing any of this information. The explanation of assessment tools must be delivered in a culturally sensitive explanation, ensuring that clients as well as their guardians, if necessary, can fully understand and engage in the process. This shared understanding is critical for effective communication. It's important to recognize that most assessment tools are used to gain insight into a client's presenting needs, which then informs the development of individualized treatment plans with realistic and attainable goals. This information also guides our treatment approach and intervention style. It's crucial to acknowledge that many assessment tools have been normed and validated predominantly on Caucasian males in their 40s. This highlights the importance of considering cultural factors when assessing and evaluating and interpreting results. Counselors must be aware of the cultural implications of these factors and how they can impact the assessment process. There are lots and lots of assessments out there that can be used in counseling. This section is going to explore just a few examples to provide a brief historical background to give you a context on the origins and the purpose of these tests. Ability tests fall within the cognitive domain of assessments, and they can be categorized into achievement tests as well as aptitude tests. In terms of achievement tests, examples include something such as the Shervoss battery for diagnostic testing, which evaluates readiness for change or the ability to progress from one educational level to the next. The Iowa Test of Basic Skills and the Stanford Achievement Test are also examples of achievement tests. On the other hand, aptitude tests typically focus on assessing cognitive ability, intellectual functioning, and intelligence, often through intelligence testing and neuropsychological assessments. These tools help measure the individual's potential and cognitive abilities. Alfred Binet was a pioneer in the intelligence testing community in the early 1900s when the French government tasked him with assessing students' levels of classroom functioning. In response, he developed the Binet Intelligence Test, which is an IQ test measuring skills beyond those explicitly taught in the classroom. The focus of the test is on problem-solving abilities and attention span. Here, if you click on that link, you can see the Stanford Binet test, which includes 50 questions, typically takes around 12 minutes to complete. Additionally, there are more comprehensive IQ tests containing 100 questions, usually completed in about 24 minutes. This test also offers a brief history of the Binet test, currently in the 5th edition. Just to let you know that intelligence testing is often done in person. While this is a fun option for you to use here online, something like the WACE, which is the Wechsler Adult Intelligence Scale, is something that I was always trained on and often use. That one is normally done in person because there are some hands-on options that need to be done, maybe, for example, block design. So just know that there are lots of different IQ tests out there. The Alfred Binet intelligence test is an excellent option, as well as the WACE. One of the additional implications to intelligence testing worth considering is a significant figure in the field. His name was Robert Yerkes, a name that you may encounter in your studies. Yerkes developed the alpha and beta test for the U.S. Army during World War I. With his extensive educational background, Yerkes was well equipped to collaborate with the Army to develop intelligence tests that would assist in determining how and where soldiers should be placed. Prior to these tests, soldiers were often assigned to the front lines without regard to their specific skills or capabilities. However, the introduction of these intelligence tests during World War I, soldiers were then more strategically placed in positions that aligned with their educational and cognitive abilities. The Alpha test was a written exam designed to assess literate soldiers for enlistment. It was administered to large groups and typically took about an hour to complete. However, this test has some biases, particularly in relation to socioeconomic status. For example, one question asked about Crisco, a cooking product that was relatively expensive at the time. Soldiers from a lower SES background might not have been familiar with Crisco and could have selected an incorrect answer, which could skew the results. Other questions reflected biases based on geographic location, education, and access to popular culture, such as references to famous athletes, which some soldiers might not have been exposed to due to lack of access to radio or athletic events. The beta test was developed as a secondary pictorial test for soldiers who were illiterate or who did not pass the alpha test, and this test also contained cultural biases as well. Soldiers who failed the beta test were referred for individual assessments, which highlighted the early recognition of cultural implications in intelligence testing in World War I. So here are some examples of test items. On the left, you can see the differences between the alpha and beta tests, with the alpha test using narrative-based questions and the beta test featuring pictorial questions. On the right, there's the specific beta test items asking soldiers to identify what was missing. In the top row, the correct answer is number 2, indicating that the person in the image is missing eyes, which is a distinguishing feature not present in the other images. Cultural bias and implications in both the alpha and the beta tests are quite evident. While in its historical context, it may feel very distant and difficult to fully grasp, it's important to understand that the impact of these tests had on the Army's assessment of intelligence. These tests led to a distinction between superior and inferior intelligence, often categorized by ethnic groups. Though the terminology used at the time does not align with contemporary standards, it was considered relevant during that particular time period, and the cultural biases inherent in tests influence the results, creating disparities within the military and affecting the opportunity given to soldiers, whether in terms of advancements or limitations. Here we're briefly going to touch upon personality tests, which primarily focus on the affective domain. Some personality assessments involve projective techniques, such as the Rorschach inkblot test you can see there on the upper left-hand corner, while others are more objective, such as multiple choice questions that assess interests, likes, dislikes. Some examples include the MMPI. We're on the 3rd edition right now. Another less rigorous is the Myers-Briggs type indicator. These tests are often used to identify personality traits relevant to career suitability, among other purposes. However, it's important to remember that many of these tests were originally normed on Caucasian males in their 40s. Therefore, there's a growing need to update assessment tools that are normed on more diverse populations to better serve client welfare and addressing presenting needs in the counseling field. As I mentioned, the MMPI 3 came out not that long ago, so they are doing a better job of trying to update their norms and make it more valid for today's day and age. There are different types of assessment techniques, including norm referenced and criterion reference assessment. Norm reference assessments compare scores to establish norms and assign meaning based on those comparisons. For example, scores on tests like the ACT or the SAT may be compared to national samples to determine where an individual falls on a bell curve. In contrast, criterion reference assessment focus on mastery of specific subject or skill, and there are more individualized. For instance, a certification exam like the NCE would be considered a criterion referenced test. And depending upon the test, you may see a combination of these approaches with either comparison to norms or evaluations of mastery. Additionally, assessments can be classified as standardized or non-standardized, with the distinction being fairly self-explanatory. When evaluating research quality, we must consider both validity and reliability. Validity refers to the extent to which an assessment tool accurately measures what it is intended to measure and performs as designed. In essence, validity asks whether the instrument is accurate. Reliability, on the other hand, refers to consistency of the tool over time, asking whether it consistently measures what it is supposed to measure. For validity, there are 3 types: content validity, criterion related validity, and construct related validity. Now, there are others. These are just the ones we're going to talk about here in today's lecture. Content validity examines whether the test accurately covers the subject matter that it's intended to assess. Criterion related validity evaluates how well the test results correlate with specific outcomes, and construct validity asks whether the test supports the hypothesis being tested. For example, if I hypothesize that a hummingbird will visit a feeder 10 times a day, this test should help gather data to support or refute that claim. Reliability, on the other hand, involves ensuring that the instrument is consistent and dependable. This includes test-retest reliability, where the same test is given at two different points in time to assess consistency, so at time 1 and then comparing the scores to time 2. In behavioral health settings, we frequently administer tools to assess readiness to change, or the PHQ-9 or the GAD-7 at regular intervals to track progress and identify new needs. This helps assess whether a person is ready to move forward in treatment or to close treatment based on their scores. Other reliability measures include alternative forms, which identify correlations between two different versions of the same test, a split half reliability, which assesses consistency by comparing different sections of the test. Internal consistency refers to the relationship between these sections and is often measured by averaging the split half results. It's crucial to understand that validity is more important than reliability in counseling, especially when it comes to diagnosis and treatment planning. A valid test provides us with an accurate measure needed to properly diagnose the individual and then determine what would be the best treatment. For example, in assessing ADHD, we need a test that provides a valid measure to guide diagnostic decisions. In the diagnosis, is it provisional? Does it lead us in a different direction? This will directly impact treatment planning. However, it's important to note that a diagnosis should not automatically dictate treatment planning. We must ensure that treatment planning is personalized to the client's specific needs, moving away from a program-driven approach. By using valid and reliable tests, we can accurately identify those needs and create individualized treatment plans based on concrete data. When evaluating research methods, two primary approaches are important to consider: quantitative and qualitative. Quantitative research is typically focused on testing hypotheses, while qualitative research is centered around exploring lived experiences and gathering insights through open-ended questions. For example, quantitative research, which is more hypothesis driven, you'll encounter experimental and non experimental research methods, each with various subcategories. In contrast, qualitative research aims to capture deeper understanding through methodologies such as grounded theory, phenomenological studies, ethnographic research, and consensual methods, each focus on different types of experiences and aspects of the human experience. In the field of assessment, evaluation, and interpretation, we must consistently prioritize cultural considerations and advocate for practices that support fair and ethical standards. This includes adhering to confidentiality protocols, ensuring that informed consent is obtained, and clearly explaining the client's rights. Clients should be fully aware and acknowledge them and willingly consent to treatment. When it comes to releasing information, we must have the client's consent before disclosing test results. In situations involving forensic proceedings and court orders, this does definitely become more complex, but should always consult with interdisciplinary teams, including colleagues such as psychiatrists, psychologists, and supervisors, to ensure that we remain within our area of expertise. Assessment tools and counseling serve not only to guide treatment, but also to help ensure quality assurance within agencies. They help determine the length of treatment episodes, assess progress, and evaluate the client's ability to adapt to changing needs and goals. It is essential that we are competent in administering these tools, which requires proper training and education. Familiarity with these concepts like validity and reliability is critical, as the use of these tools are normed to the client's cultural identity, especially when diagnosing. Cultural sensitivity is crucial. The DSM can guide us in diagnosis, but we must be mindful of cultural norms surrounding diagnostic criteria and tools. The history of social prejudice in diagnosing of certain pathologies, such as the Tuskegee Syphilis Program, emphasizes the need for cultural awareness and assessment. Given again that many of these tools were normed on white males in their 40s, we must advocate for more inclusive tools and avoid perpetuating biases in our practices. These tools must serve therapeutic purposes, they must not cause harm, and should guide treatment in a way that reflects the individual's need. If we find ourselves questioning the client's progress or the effectiveness of treatment, it's important to step back and assess the tools we're using. Are they appropriate for the cultural context of the client? Should our interventions be adjusted to better meet the client's unique needs? These reflections will lead us to fair, ethical assessment procedures. The ACA Code of Ethics provides clear guidelines on assessment, interpretation, and evaluation, emphasizing the importance of proper diagnosis, cultural sensitivity, and competence. Additionally, resources like the Code of Fair Testing Practices and Education and the Association for the Assessment of Research and Counseling can help ensure our practices remain fair and equitable.